Greetings, everyone. My name is Cinzia Donato, R&D Manager at Scailyte, focusing on women's health. Every month for Scailyte is Awareness Month. So today I'm happy to present the third episode of Scailyte's endometriosis interview series. Scailyte is a precision medicine company based in Switzerland. We have developed our proprietary machine learning algorithm, the SkyVision platform. Starting from single cell data and clinical data sets, we discover unique cell populations and clinically relevant biomarkers for diagnostics, prognostics, and treatment. SkyVision has discovered a variety of biomarkers, tackling projects in the immunology and oncology space, as well as in women's health. Together with the University of Bern and Seespital Horgen, Scailyte is on a mission to advance endometriosis research and knowledge through biomarker discovery. Globally, 1 in 10 women of reproductive age is affected by endometriosis. Yet, many people are unaware of this chronic and irreversibly debilitating disease. Endometriosis is characterized by the growth of endometrial tissue outside of the uterus, causing inflammation and pain, which often starts with the first period in young girls. About 50% of women with endometriosis also suffer from infertility. Diagnosis, treatment, and management of the disease are fields with a lot of room for improvement. In this endometriosis awareness series, we are interviewing prominent exponents and stakeholders to discuss awareness, challenges, and opportunities in endometriosis. A little disclaimer for you: when we speak about girls and women, we also refer to transgender and non-binary individuals. Today, we have the great pleasure of speaking with Dr. Alina Staikov. Hello, Alina.
Hello, thank you for the invitation.
Thanks to you for joining us. She is a specialized gynecologist. She completed her medical studies at the University of Sofia in Bulgaria and specialized in gynecology and obstetrics at the Charité Hospital, Berlin. Alina is also certified in educational programs in gynecology and obstetrics. Since 2013, Alina has worked as a private practitioner, and in 2019, she founded Gynpoint, a gynecology and obstetrics practice with locations in Zurich and Horgen. Gynpoint offers the whole spectrum of modern diagnostics and therapeutics and consults over 7,000 patients a year. As a collaborator with the Endometriose Vereinigung Schweiz, Alina plays a critical role in raising awareness for endometriosis. Thank you again, Alina, for being with us today.
Thank you.
To start, I have a very simple question. Are young girls who are just starting their periods and their parents aware enough about endometriosis and what endometriosis causes?
The most are not aware about endometriosis. At the beginning of the reproductive phase, it's marked by the start of the menstruation, and this is mostly or often tied to irregular cycle, but also painful cycle is not uncommon. And because this is a new situation for the young girls, it tends to be interpreted as something normal, to be underestimated and to be played down the role. But I have to say that sometimes come young girls to the consultation exactly with this question about endometriosis, or mothers ask about their daughters just because there are some cases in the family of endometriosis. And for the second example, probably the mothers are suffering of endometriosis.
What does endometriosis awareness look like in women aged 30 plus?
I would say that one should start to talk about endometriosis already in the adolescence, but mostly the women over 40 are in the focus of the endometriosis. And I think just because the coincidence to show the symptoms, or to is the time when we have the diagnosis of endometriosis is around this age, and also because of infertility problems regarding this age.
Do you see many patients that come with infertility issues and you refer them for endometriosis?
We have to notice that, and we know this already because of the research and also our practice, there's 30 to 50% of the infertility patients are affected by endometriosis. And of course, the infertility problems, what we see every day here in the praxis, often are connected or tied to endometriosis. Yes, we see those patients.
So at the moment, it takes between 8 and 12 years on average to diagnose women with endometriosis. Would there be a benefit to the patients if we were able to diagnose them in much fewer years and definitely earlier in their patient journey?
It is still not clear whether we could influence the course of the endometriosis if we would earlier know about the disease. But notice the symptoms, or having agenda, using apps, this have a potentially benefit at first of all for the women, because like this they can complete the traditional history more accurately, to pay more attention to the pain, to objectifying the pain, and also to empower them to demonstrate their symptoms. These are, by the way, also in the newest guidelines from ASHRE is also like this is noted. And if we would able, because of the symptoms, this agenda a little earlier to go to the diagnosis, or to confirm or to suspect the diagnosis of endometriosis, also to clinical examination and timely presentation for the gynecologist, I see this like a huge psychological impact for the patient. We have to involve in this process or discuss with the employers, with the family, with the partners, because it's important on one hand to understand those patients, and on the other hand to give them support. And I see that earlier diagnosis of endometriosis has a huge psychological impact, but also is giving a good control of the disease and the treatment.
You mentioned slightly earlier diagnosis for endometriosis would have psychological impact. What brings you to this conclusion?
The patient suffering a lot. In the beginning, these are fears of the unknown. They don't know what they have. They are searching, they are asking why they have the pain, why they have problems during the intercourse, why the urine bladder is not functioning like for other women. So this unknown situation is a huge stress factor for those women. And once they get the diagnosis, there is an endometriosis. This clarification, at least, is a milestone in the psychology for those women. And then the next steps, what is the plan? How we go further with the diagnostic, with confirming this diagnosis endometriosis, what that means, what that means about the fertility. It's very important to have this agenda in their mind and in their all day. So just to know how to plan their life and how to live with endometriosis day by day.
Right, this is a really important. Changing a little bit the topic, what costs are involved in consulting, diagnosing, and treating endometriosis patients? And what are the costs generally covered by insurances?
The endometriosis as disease has a chronic course, and the costs are comparable to costs to other chronic diseases like diabetes, morbus Crohn, rheumatoid arthritis. There are some studies from different countries, but I'll mention, for example, like the studies from Austria. They're showing this cost in the millions. It's about 7,000 euro per patient per year. That means more than 300 million per year for those patients. We have the same studies from Australia, but there we have in the billions area, $6.5 billion for those patients. And from the United States, is observed and confirmed that the cost for endometriosis around 11 to 70% more than the cost for those patients with diabetes. And the insurance is covering the diagnostic and the treatment, but these are huge costs for the health system. I would like to say also, to mention also something else. On the one hand, we don't have to underestimate the problem. On the one hand, we have the healthcare costs, but those patients are affected by productivity on their workplace. They have decreased productivity because of the chronic pain, because of the take-off day of the works, the sick leave. They losing around 6.4 hours per week because of it. And the most of those, or part of those, just lose their jobs or their partners. And as I mentioned before, it is important, very important, to involve in this understanding process and supporting process, the family, the employers, the partners.
This is a really important topic that you just mentioned. What are gynecologists like yourself doing to spread awareness and educate people, but also institutions and regulators in endometriosis?
We always must start with information, education, awareness. If somebody is good informed, could find good decisions. We launched in 2020 our project, Love Letters to My Uterus. And with this project, on one hand, we wanted to put in focus the image of the life with endometriosis in the aim to increase the attention to it in our community, and one side, but on the other side to raise awareness. And with this second part of the project, we started to send gynecologists, pediatricians, and the schools age-appropriate brochures, flyers, for 2 years now in the canton of Zurich. But here now, this year, we sent more than 3,000 flyers to more than 3,000 addresses in the German-speaking part of the Switzerland. And our message was delivered mainly to the adolescents, where we have to start to talk about endometriosis. In 2020, with the project Love Letters to My Uterus, we photographed 28 women with endometriosis. They told their story in images in front of the camera. It is very impressive project, but the emotion which are affected by this kind of communication, to see how they live with endometriosis, to understand how they suffer, to know how they manage their day with endometriosis, is really impressive, and I think important also those methods, those tools to use to communicate nowadays, to communicate with all these partners, the family and employers and their partners, just to understand what is endometriosis. And it is so often this condition, 10% of all women in reproductive age are affected by endometriosis, just to know how they manage their day.
Thank you very much, Alina. This is a great insight, very valuable insight.
I just want to say how important this is. Not it is not so easy to understand what those people going on, and it is very helpful if everybody of us could, at least for 2 hours, be on the place those patients. And this is not so easy to have empathy, but this is helpful. So we all have to imagine and to try to understand how is the place to be on endometriosis patient, then to be critical about their behavior or their complainings. Yeah. This is one what I wish for the future. And the second thing is just to invest more costs for the funding, to go for more research, to don't give up in our goals, because it's important. I think even if it's still let's say not clear if we could influence the course of the disease, but I think there is a benefit if you would know 3, 4, 5 or even 10 years before, if we have sometimes average 12 years from the beginning of the symptoms till the diagnosis. So we could minimize this unknown period with suffering for those women and be able to give or to support better therapy strategies and better treatment, which give their normal life and normal quality of life.
Thank you very, very much, Alina, for your time and for sharing your valuable insights with us today. And thanks to all of you for your attention and interest in learning more about endometriosis. Endometriosis carries a substantial economic burden and a great toll on patients' mental health and career paths, as we just heard. As a society, we must think about the economic repercussions and the empathy that it takes to find solutions. We need better solutions, and Scailyte is committed to that. Stay tuned for the next episode of this series.